All right, good afternoon and welcome to Bridges to Community. My name is Sarah Turcott and I work at Bridges by Epic at Westford.
And I'm Erica Lab, Executive Director of Bridges by Epic in Westford, and we're happy to have you here to watch the show today. We have a wonderful guest with us today, Dr. Rachel Movitz. Dr. Movitz is a licensed clinical psychologist specializing in issues pertaining to aging, caregiving support, bereavement, adjustment to retirement, and other late life transitions. She provides neuropsychological assessments for older adults experiencing cognitive disorders, and she can assist in identifying the etiology of symptoms and facilitate the development of an appropriate treatment plan. Dr. Movitz is based right here in Westford, and boy, you do a lot. So that's a mouthful. We're happy to have you. Yeah. Thank you so much for coming.
Thank you. I'm happy to be here. Thanks for having me.
Great. So today I think mostly we're going to talk about Alzheimer's disease and sort of cognitive impairment. So if you want to start, I think just for the purposes of our viewership, just in case, maybe just go over what the difference is between dementia and Alzheimer's.
Absolutely. And that is a question that comes up all the time, in my work with people is it Alzheimer's? Is it dementia? Is there a difference? What does this mean? So I'm so glad that you asked, because I think it is important that people understand that Alzheimer's disease is a disease that can cause dementia. Dementia is a larger term for an umbrella of symptoms or cognitive deficits that people may have, which may include memory difficulties, so that would be short-term memory difficulties in most cases early on, difficulty with communication, possibly getting lost in familiar areas, and so as the disease progresses, the symptoms get worse, and the cause is something called Alzheimer's disease. But dementia can be caused by other risk factors. So there can be cerebrovascular risk factors. So that would be chronic high blood pressure, high cholesterol, diabetes, history of strokes. And so people can have dementia, which again is that umbrella of cognitive deficits. It might look different from Alzheimer's disease, but there still can be this cluster of cognitive deficits that are caused by that type of etiology. And then Parkinson's disease, something that's a little bit less common, called Lewy body disease, and some other types of medical conditions can also cause dementia. So it is important, I think, that we understand that Alzheimer's and dementia are not the same thing. Alzheimer's is something that can cause dementia, and as other medical conditions can cause dementia.
Right. Absolutely, and we know that there's well over 100 different types of dementias. That's I think it's important for the audience to know that not one person goes through this disease process the same as the next.
Right. That's right. So even with the same diagnosis, people look different because we are all individuals, and we all have our own way of experiencing something such as this. So that's so important, I think, that you pointed that out.
Yeah, absolutely, and I think it goes into our first question, which is, what are the risk factors for developing Alzheimer's disease or any type of dementia?
Sure. So at this point, about 5.7 million Americans are living with Alzheimer's disease in this country, and the estimate is actually from the Alzheimer's Association. The last estimate I saw is by 2050 they're estimating that it may be about 14 million people. So that's more than double.
Epidemic.
And yes, an epidemic, and certainly of great concern. And so the idea of prevention is important because there may be things that we can do to prevent the disease, and they are learning more about preventive strategies as we get further into doing research. Unfortunately, we've had decades of research looking for disease-modifying treatments or cures, and we're not there yet. But what we do know is that there are certain risk factors that certainly can we can be aware of, and may if we target some of these risks earlier, we may either be able to prevent the disease, hopefully, or at least if it is developing, to slow down the progression.
Sure.
so that someone's quality of life is going to be better for a longer period of time.
So important.
Yes. So age is the greatest risk factor, increasing age for the development of a disease such as Alzheimer's.
We can't stop that.
Right,
Yeah,
we can't
anyway,
stop
no.
age. Exactly, right.
We'd be
Even with the
millionaires if we could.
superfoods, right. But the superfoods do help, so I will get into some of that, what we call
Great.
the superfoods, because that is an important preventive strategy. And I think even though we don't have medications, we underestimate the role of diet in terms of preventing this type of disease. So, and other neurocognitive disorders or dementias. So I mentioned vascular dementia, vascular disease. Both Alzheimer's disease and vascular dementia, or cerebrovascular related neurocognitive disorders, are linked in that the brains of people who have Alzheimer's disease, about 80% were found to have cerebrovascular disease. So this is a newer finding, which I think was very unexpected. And certainly there's a direct link if someone has chronic high blood pressure, high cholesterol, diabetes, some of those risk factors, strokes, heart attacks, and they have cognitive impairment. Usually it's pretty clear that that link is there.
Sure.
So we want to be focused on the idea of what we eat and the things that can increase those risk factors or decrease them. So clearly eating foods that are high in saturated fat and cholesterol are things we want to avoid. Also foods that are high in sugar, because the sugar can actually lead to diabetes, and it can also lead to problems with the metabolizing fat, and
they're both very hard to process.
Exactly,
Yeah.
exactly. So it's very important to focus on the good fats, that we don't get enough of these in our diet. So some people say, well, how can a fat be good? Mm-hmm. We want to look at the what we call the high density lipoproteins, or fats that are in products such as walnuts and almonds.
Maybe even avocado.
Yes,
Yep.
yes, all those good things that people feel like they shouldn't have, but they
which we all
clearly
gave
have.
up during the 90s, because to lose weight.
That's
we all gave
right.
them up,
That's
right.
right. But now they're finding they are superfoods
And they are
can have
delicious.
benefits. They are
That's
delicious.
good.
That's right. So to keep eating those walnuts and almonds, it can be good, but to cut down on the foods that are higher in the LDLs, which are the bad fats or the fatty acids that we don't want to be consuming, is important. We also want to focus on dark green leafy vegetables, the dark berries. I love dark berries. So those types of foods can have high antioxidant content and be very good for our brains, our brain health and wellness. And not only do we want to be thinking about what we're eating, but also monitoring vitamin B6, B12, and folic acid. So some doctors don't routinely check for these things, but it's helpful, particularly in those that may be at higher risk, to routinely have this looked at as well. And especially if people are drinking alcohol, there's a high risk for low levels of vitamin B12 and thiamine as well. And so those issues can be linked to higher risk for development of dementia and Alzheimer's as well.
So it's not true about the red wine?
Yeah, it depends how much you drink.
It depends on how much you drink.
Everything,
Exactly.
I guess a whole bottle.
Well, that's the thing. They were saying, oh, drink your wine, but now they are finding that even moderate amounts of alcohol in some individuals can cause damage to the brain.
Sure.
And can increase the risk for either dementia related to alcohol or Alzheimer's disease in some cases as well. Sure. So I think, as you said, in moderation, but not too much.
Right.
So even 2 to 3 drinks in an older adult can affect cognition. So really, I think we want to focus on limiting alcohol.
Yeah.
Just going back to the blood levels, are those those particular ones, are those looked at a typical blood panel that you'd get when you go for a physical, or do you have to special request them?
It varies by physician. I think as people get to the later stages of life, it might be, there's some doctors that are more comfortable ordering it as a routine panel, but it's not always the case. Okay. Not all doctors order these tests. So I think that if people know that they have increased risk, so another increased risk would be genetics. Mm-hmm. There is a gene called APOE4, and some people with this gene are at increased risk of developing Alzheimer's disease, but not all people with the gene go on to develop Alzheimer's, and there's several mitigating factors, which diet can be one of them, and prevention of these cardiovascular, cerebrovascular.
Yeah, people ask that all the time if they have a loved one, and if this is a disease that runs within their family, are they at risk or more at risk, or can you talk a little bit about that?
Sure. There is an increased risk, but the good news is that it doesn't mean that people will definitely develop the disease. So they have found that people can be tested and have the gene but not develop the disease. And the disease itself, when we're talking about Alzheimer's disease, it's caused by amyloid beta protein deposits that are not being cleared away in the manner in which they should be. And so these aggregates of these proteins form, as well as clusters of what we call tangles, neurofibrillary tangles. And these protein, it's tau that causes the tangles. So the beta amyloid and tau tangles can actually cut off the connections between our nerve cells. And that space between the nerve cells is called the synapse. And so they have found that there's a higher risk for people who have the gene of having this process happen, which is, it's an abnormal situation. These types of proteins are supposed to be cleared away, but this does not happen when people have Alzheimer's disease. The proteins build up, and there's more and more progressive nerve cell death, and that's what causes the cognitive deficits, the memory deficits that people experience. So, but that being said, there are a lot of people who, after when they've done studies post-autopsy, a lot of people who've had the beta amyloid in their brain and haven't developed Alzheimer's, and a lot of people with the gene, the APOE4 gene, do not develop Alzheimer's. So I think, again, it really gets back to those who engage in preventive strategies. That might make the big difference. Sure. I don't think we have enough research to know why some people don't, but they are saying that in some of the research there's something called cerebrospinal fluid, which contains evidence of this tau protein, and in those who have Alzheimer's disease. And there is a recent study that I read that indicated that if people exercise for I believe it was 3 times a week for around 40 minutes a day or a session, or brisk walking for about 2.5 hours a week total, that if they have this gene, they may lower their risk of developing Alzheimer's disease. So that speaks to the fact that there's something that people are doing that has a direct effect and can reduce their risk even if they do have this gene. So that's pretty interesting. And I think the diet is clearly going to play a huge role, especially if people have risk factors for diabetes or high blood pressure, high cholesterol. If those tend to be familial, then starting younger in life with watching those types of issues can be important. So if we have that gene, really paying attention to those risk factors. Right. So exercise, diet. The other thing is that lower education is a risk factor for the development of Alzheimer's disease, but at the same time, cognitive stimulation can help prevent the disease and slow it down if it is starting. So, and the important thing as well to consider is what type of cognitive stimulation. So sometimes people think if they're doing crossword puzzles, that's adequate, but they're actually showing now that you need more than that. That's retrieving information we already know. And for a disease with Alzheimer's, where the synapses, where learning takes place, communication, perception, when those synapses are dying, then you're losing those functions. So if you're engaging in new novel tasks, things that require learning rather than retrieving things we already know, but learning a new language or learning how to do something new, taking a class,
Piano
reading.
Challenge yourself.
Yes, challenging.
Right.
If you're using those strategies, you're actually maintaining the connections between the nerve cells that are there, keeping those synapses there, and also maybe even creating some new synapses. So there is neuroprotection. There is a possibility of bypassing some of these bigger risk factors by our day-to-day behavior and whether we're intellectually stimulated. And they are finding loneliness and depression.
I was just
can
going to
be
say
big risk factors.
The learning something new could go hand in hand with being part of community.
Absolutely.
And engaging in community. And I think we see depression increase when we're lonely and not part of the community. And as we age, we lose friendships, we lose family members.
That's right.
So your
Something
world
bigger.
gets smaller. But if you get out and take a class, and there's so many things in this community alone that we could get out and do that bring you both things at once, community and new opportunities to learn.
Absolutely. Absolutely.
It's also funny what you said about the crossword, because so many people will say, well, my husband is fine, he still does the New York Times
Right.
crossword. Like that's like the thing that if you can do that, you're fine, because you've got to be really smart to do that.
Right.
But it's retrieval more than learning new things.
Exactly. And if you think about a disease such as Alzheimer's, the long-term memory tends to be preserved into the later stages of the disease. And it's the short-term memory or the laying down new memories that's affected as the disease starts and progresses. So if we're retrieving things we already know, we're not challenging the part of our brain that lays down new memories, and we're not building those connections, and that would be the hippocampus, the memory center of the brain. So interestingly, they actually found that in individuals who do exercise, they also had larger hippocampal volumes. So that part of the brain that is involved in memory was larger. And another study that I saw on mindfulness indicated that for people who engage in mindfulness meditation exercises for only 8 minutes a day, they also had larger hippocampal volume.
That's what I wanted to ask you about the stress. So the stressful lifestyle, which we can have at any age, and you just mentioned meditation. Can you talk a little bit more about mindfulness meditation, but also stress in your daily life and how that affects
Anything we could do to
Direct
really
link.
prevent.
Yeah.
Right?
Absolutely, there's a direct link, and this is newer research too, so I'm so glad you're asking about that too, because I did want to touch on that. That
We did talk before, so everyone knows.
the effects of stress can be very negative for people who have these risks, and for any of us in general. But I think for those who have the vulnerability already, so they have the genes, they are of increasing age, and they're under chronic stress, maybe they have these cerebrovascular risk factors. I think the stress is really going to throw things into a quicker loop in terms of deterioration, cognitive deterioration. And they have found that cortisol is a risk factor. Increased cortisol, which is the stress hormone, is a risk factor that is directly related to the development of Alzheimer's disease and dementia from Alzheimer's. So, so there is that direct link, and it's also been found that in veterans who have a history of post-traumatic stress disorder, that they have an increased risk for developing Alzheimer's disease, and traumatic brain injury as well. If you think about inflammation for the brain, traumatic brain injury, especially repeated injuries, can create an increased risk. And if you combine that with post-traumatic stress, the risk increases even more. And so we are seeing veterans with these both of these risk factors that have a higher incidence of Alzheimer's disease and dementias. related dementias. So
you got to use all these other things to try to offset either the family history or the
effects of
PTSD
age,
or the age
PTSD.
or all these other things to fight against that.
Exactly.
Or even if you're living with this disease, I think that some of the things that you mentioned can just really bring on a better quality of life.
Absolutely, and that's the thing that I think is so important, that as well, that the amyloid beta plaque deposits, the tau tangles, all of that starts in the brain about, it can be 15 to 20 years before, in some cases before people have the clinical symptoms that indicate the presence of Alzheimer's disease or some other neurocognitive disorder, dementia. So what's important is to be aware that any of us could have the risks and be asymptomatic, but we should be engaging in these preventive strategies, whether or not we have the gene, whether or not we have a cerebrovascular risk factor. It's important that we are all thinking about these risks, and the fact that if things are starting that we are not aware of and we're asymptomatic, but there is something going on that is progressing, that we can slow down the progression of the disease and also improve quality of life. So who wouldn't benefit from stress reduction? Who wouldn't benefit from a healthier diet, from its social and intellectual engagement? Those things are going to make people feel better. They reduce depression, they reduce loneliness, they have a better impact on our general health and well-being. And the other thing too is sleep. People underestimate the importance of sleep, and there is some new research as well that beta amyloid plaques can be caused by chronic insomnia. So I even heard that after one night of not sleeping, some people can see some buildup of these proteins. Now, most people will be able to clear them away, but it's the sleep deprivation itself that can be linked to producing some of these abnormal clusters of, and if it's chronic, it can happen
Really build
at a more
up.
exactly
You're
more
caring
accelerated.
for someone. If you're the partner of someone with this disease and you're up at night, not only does your partner already have it, but then you're doing damage to your brain up all night watching them.
Absolutely. Yep.
Yeah, that's hard to
It
get
is.
that sleep in.
It is, and some people think that the over-the-counter medications for sleep can be helpful, but unfortunately there can be what we call cholinergic effects, and acetylcholine is the memory chemical or memory neurotransmitter in the brain. So unfortunately some of these over-the-counter sleep aids can actually have anticholinergic effects and increase the risk for memory problems. So that's important too, if for caregivers who aren't sleeping well, to avoid, for the person who has the disease, Alzheimer's disease or another dementia, to avoid taking those as well as the caregivers, because that isn't necessarily going to help in the long run and can put them at increased risk. And then there's the stress factor, and caregivers, unfortunately, they are at increased risk of burnout. And
it's a family disease. It's not just affecting the person living with it. And
that's right.
I know that you wanted to share some resources and maybe just some advice for people who are caregiving with someone with memory impairment, because I think it's good for them to know that they have resources and that there's help out there for them too. Absolutely.
Yes, it is a whole family disease. I think that's so well put, that it really does affect everyone. And it is important for caregivers and loved ones to be taking care of themselves. And it's very easy to forget that. So the resources in the community are so important to tap into, programs that are stimulating. Sometimes people are afraid, oh gee, if I send my loved one to a program, am I failing? Well, actually, it could be very helpful. It could enhance and enrich their quality of life. Exactly.
Engagement.
So to not feel like you have to be doing it all, but to actually allow others to do that for your loved one can be really helpful. And also to give you that space to replenish yourself, to maybe get some sleep, and also to exercise,
do the
or
self-care.
do the self-care. Exactly,
Fill your
those things. Fill your cup. I love that. Yeah, it's really just I think people underestimate that, and I think part of it too is that there is when you're going through this process with someone, it's very difficult to know how much you should give, but. You have to keep your cup full, as you mentioned. It's if you burn yourself out, you're burning the candle at both ends. You're not going to be able to help in the well-being of your loved ones. So, so taking advantage of any type of programs, enrichment, socialization opportunities, ways of managing one's own stress, and also watching diet and other risk factors are that caregivers are at higher risk of developing chronic conditions themselves, not just depression and poor sleep, but also there's a higher risk of cardiovascular disease, of diabetes, and cancer. So there are so many reasons why it is so important to get help and support. Yeah. Exactly.
And even reaching out and maybe finding a local support group, whether it be at your senior center, or I know Bridges has a support group.
You have a wonderful support
third
group.
Monday of every month at 4:30. So I mean, it's just good to be amongst people who understand and truly get it, and just give each other tips and tools for just being a more empowered caregiver.
And you
so
see
true.
Patients privately, correct?
I
Clients?
do, yes.
Yeah.
I have a private practice, and I do see caregivers, and it is covered by insurance. So often families aren't aware that they can have coverage for supportive therapy as they're going through this process, and it can help them to take care of, start that process of taking care of
Filling their
themselves.
cup back up.
important.
Filling the cup back up.
You're a cup filler.
Yes, yes. I always say it's a team effort. We do it together.
That's right. That's right.
So, and then if they can be good for themselves, then they're being good for their loved ones too.
Absolutely.
So, yes, and my information can be accessed on the internet. I'm on Psychology Today, as well as the Massachusetts Psychological Association, my contact information.
Great, and you're right here in Westford. So.
I am right here in Westford.
No excuses,
Great town.
people. No excuses. That's great.
Well, we thank you so much for being here today and just sharing with us, you know, both your knowledge, but also just letting our viewers know that there is a local resource here in town. You are not alone, and if you ever need Rachel, don't hesitate to reach out. She's just a value add to our community here in Westford, and we thank you so much for viewing, and we hope that you join us next time.
And thank you so much for having me.
Thank you.